Hello, everyone. Are we live? It's Dr. Goldie. I am your health and wellness expert and double board certified obesity medicine physician. And through my obesity medicine practice, my online courses, through my speaking and best selling books, I help professional women just like you to find time for fitness, ditch dieting, and make mindset shifts necessary to help you lose weight so that you can really change your lives. So, this month is National Minority Health Month. And this is near and dear to me because obviously I am a minority physician. So, as a Black woman, I wanted to come on live and talk to you guys about, uh, you know, our health. What are we doing to get healthy as minorities? And what are the barriers that we face that overcome or that contribute to the health disparities that we face, right? So, my thing is health and wellness. I'm all about improving health and reducing chronic diseases in the minority community, right? So, most of my patients or my clients are minority people, and most are actually women. But as minorities, we face a lot of disparities, and it's pretty evident in our community, right? So we've got chronic illnesses. African Americans and other minorities are more likely to face chronic illnesses. We suffer from more diabetes, more hypertension, more heart disease than any other culture. We're more likely to die from cancer, these types of chronic illnesses that we need to battle. But why do we face these things? It comes from decades of issues in the American healthcare system, right? We have faced decades of poverty, segregation, um, discrimination, and it has all affected our health, right? Um, there are disparities in insurance. Minorities are less likely to have uh, private health insurance than other races. Um, we have fear. Uh, African American people, in particular, were more likely to have a fear or distrust of the healthcare system. How many of you have family members or relatives who don't trust doctors? Here I am, a physician, a minority doctor, and I have people in my family who will not go to the doctor for healthcare. They don't trust the system, right? They will always bring up the Tuskegee uh, experiment. They will always bring up the thought that what COVID was a man-made disease and that it was made in order to cause problems in our community. How do you convince people that they need to see or seek out healthcare when they don't trust the system? Um, some people don't seek care because they have a fear of losing their jobs. You don't work, you don't get paid. So if you're not going to get paid, uh, or if you don't take off work to go to the doctor, right? So that's very prevalent in our community, very prevalent. As far as like not just physical illness, mental illness. How many people have an Uncle Larry who needs to go to the psychiatrist or to seek some counseling of some sort? How many of us have people in our family who need therapy and we won't go? African American people are less likely to seek mental health services than other races of people. This is a real thing that goes on in our community. Now, leading causes of death: heart disease, diabetes, and cancers. African American people are more likely to die from cancer than any other uh, race of people. Why? Why do these disparities exist? There's a lot of thought about it. I welcome your comments on this video. Share what your thoughts are as to why we have all of these disparities and what can we do to change it. Um, Black infants are more likely to die, twice as likely as other races of infants to die. This is like crazy health disparities, right? So, like in the healthcare system, the important thing is not just to identify the statistics. And yes, the statistics are sad. It's disheartening. It's disheartening. And it's going to take generations to fix the system. It's going to take generations to change, the disparities. But we've got to like work on our mindsets. We've got to work on the things that we can change. There's, in my opinion, a great need for education, a great need for education. We have to address the poverty in our communities. We have to address the segregation. I mean, Chicago, which is where I'm from, I live in Chicago. I think it's one of the most segregated cities in the world. If you live on the south and west sides, your access to healthcare may not be the same as if you live on the north side or if you live in downtown Chicago. And just on the south side alone, I know there's so many hospitals that have closed their maternity wards, where Black women have to go out of their way to get access to prenatal care and to have their babies. And I personally experienced seeing women who wouldn't go for prenatal care because guess what? They didn't have transportation. They couldn't get to their prenatal clinics to get care. They didn't have cars. So they would come to the hospital in ambulances at the last minute, when they were in trouble. And why? Because they didn't have access to care on Chicago's South Side. So this is a problem. This is a problem in my city. What about where you live? Is this a problem for you as well? Um, According to the CDC, though, African Americans are 60% more likely to develop diabetes than other races of people, and 30% more likely to develop heart disease. Very disheartening. And coming from a family where these diseases were prevalent in my own home, I am like just astonished to hear the statistics because like I lived it. I lived it with watching my dad. I'm always talking about my father's history. Now, this is what's interesting about my family history. First of all, I want to tell you there was a study in 2015 that showed that even when certain minority groups, specifically African Americans, had higher incomes, lived in safe areas, had good health care, they still failed to partake in certain healthcare of the healthcare system. They failed to partake in wellness programs and failed to use their insurances. And I'm going to tell you, my dad worked his entire life. He worked for over 30 years as in a steel mill, and he always had good health insurance his whole life. He always did, but he didn't go to the doctor like he should have. He didn't do that. My father did not participate in his own health care the way he should have. Um, he he didn't utilize all of the resources that he had access to. And why? There's cultural things that we experience, that we go through. There are social issues that occur in the African American population that need to be addressed. We need to educate African American people about health and about wellness, about disease prevention, about the need to seek care. Education needs to be like paramount in our homes, in our culture, because if we don't change the mindset of our people, then how are we going to expect these disparities to get better? How are we going to expect them to improve if we don't prioritize education? And like, I'm so passionate about that because in our center, we see cultural barriers every single day. So I serve mostly African American women. We do have other women in our center, but I would say the majority are African American women. And every day we're dealing with uh, helping people fight through their barriers to get better health, barriers to improve their nutrition, barriers to their fitness to help them with weight loss, barriers to helping them to prioritize their own healthcare well-being and their own fitness, all of the things. Every day we face these barriers, and so we're educating and we're helping people to eliminate the issues that exist. There are real issues. Don't get me wrong. I'm not saying that there aren't, but there are a lot of things that exist just right here. There are a lot of barriers that we carry. I don't know if it's some things are generational, some things are cultural, some things are just a lack of understanding, a lack of the importance, acknowledging the importance of change. And so I'm curious as to what you guys really think. How do you really feel about these disparities in healthcare and how they impact you personally, how they impact your own family members, your own friends, your own community? Um, because this is something that definitely we want to acknowledge. We want to have like strategies. Um, we want to make things better. So this month, in April, as National Minority Health Month, we want to make sure we are working on ourselves, we are working on our family members, our loved ones, our friends, our communities, in our churches, in our schools. We need to help everyone to practice preventive health care, well care, taking advantage of all of the resources that are available to us so that we can improve our health. So, you guys, I'm Dr. Goldie. I'm your health and wellness expert. I'm the founder of Illinois Wellness and Weight Loss Centers in Chicago. Through my obesity medicine practice, through my fitness communities, my speaking engagements, my soon to be best selling books, I help women just like you who are busy, you're professional, you're successful women who need to make time, find time for fitness. Ditch the whole concept of dieting and really, really uh, prioritize healthy eating and make the mindset shifts necessary to really help you to lose weight and get well. And not just get well, stay well. So you can find me on all social media sites under Ask Dr. Goldie MD. That's AskDrGoldiemD. I'm on Instagram, Facebook, Twitter, uh, TikTok, LinkedIn, and check out my new website, which is askdrgoldiemd.com. I'd love for you to schedule a discovery call with me so I can really help you to live your best lives and not just to live well, but well by design. So thanks for joining me and happy National uh, Minority Health Month.